and hope everybody noticed that there is recording in progress. So if everybody is in agreement of this recording, we're gonna start with recording the session. I don't know if everybody else got that. So sorry, back to the answer. So yes, Huntington's disease does not follow exactly the time of onset of parents. We had multiple understandings in the past as far as depending on if you inherited it from your mom or your dad, with the belief in the tendency to have an early type of onset if you inherited from your father. However, we are discovering more and more factors that contribute to that specific time of onset. So just like everything else in medicine, and specifically in Huntington's, we are discovering more, we're answering more questions and allowing us to be a little bit more specific about that. But yes, the fact that your parents manifested a certain age does not predict when you are going to, because everybody has its own individual course. All right, now I'm gonna pass it to Dr. Chandra for the next question.
Wonderful, thank you. And I see a few more people on, so I just want to make sure we can assign everybody. Jennifer, could I put you with the team A? Would that be okay? And Sherry with team B? All right, and then Jamie we'll switch it up. Jamie with Brittany would be too strong a team in the sense, too much of the group bias, but Jamie, I'm going to keep you on standby, and I'm going to see if I can mix around teams a little. All right, wonderful. All right, so let's go ahead. So we're now going on to team C. So Brittany, what would you like?
Well, if we're going to stick with bias, then we'll go with research for 100.
All right, and Brittany, do you want to tell everyone what you do?
I'm one of Dr. Fursteming's research coordinators.
Wonderful. So great choice. So let's go ahead and let's see what's on the horizon for 100. Okay, so clinical trials are dangerous because they use new practices and medicines. Is this true or false?
False.
All right, let's see the answer. All right, and absolutely, because clinical trials are designed for research purposes, and so, you know, there's always some level of risk associated. However, in any form of intervention, whether it's an investigational drug or a procedure, before these are given to the trial participants, they go through extremely rigorous testing process, which takes anywhere from between 2 to 10 years, sometimes even longer. And in addition to safety testing, meeting ethical standards, there's also multiple scientific evidence in studies in animals, humans, and multiple other areas before these are transitioned to the various phases of a clinical trial. So only that would be the best way to kind of look at it. There is some risk associated. However, clinical trials by themselves are not dangerous for human subjects. All right, wonderful, Brittany. So we get 100 to team C. All right, so now let's, I'm going to pass it back to Dr. Ramirez-Castaneda, and we're going to go back to Philip and team A for the next question.
Thank you very much, Dr. Chandra. Okay, so Philip, if you could please choose the next question.
Treatment for 200.
Treatment for 200. Let's see what we got there. All right, so the question is, what is a movement expert who helps patients by prescribed exercises?
B, physical therapist.
Correct. So who is a physical therapist? I'm actually married to one. My wife is a physical therapist, and they are individuals that really understand what it means to move and what you can do to optimize that movement. And if there is any type of setback, how to get you back hopefully to the previous functioning. So physical therapies are a wonderful tool that helps in the holistic management of our patients. If there are people who have needs as far as guidance on how to optimize their physical activity, or if there are limitations, how to work with those limitations and get the best out of it. In the same realm of improving mobility, stretching muscles, keeping yourself fit, is also the this emphasis that we always pay on exercising, because exercises have demonstrated in multiple levels that really optimizes outcomes, and whether it is at your normal baseline health or when you are trying to deal with a specific condition, and specifically with Huntington's, that gives you a lot of motor symptoms where mobility is impaired, with issues with balance and gait. Again, going back to the guidance of a physical therapist, they're the ones that really help us create a nice plan and based it on outcomes, and furthermore, with a continuing exercise therapy or treatment that you can apply at home. So physical therapists always are helping us to help patients get better. Thank you, Philip. I'm going to pass it to Dr. Chandra for the next question.
All right, wonderful. Mary, are you ready to make the next selection for your team?
Yes, I am. I will take genetics for 300, please.
All right, let's see. So the question is, Huntington's disease can skip generations. True or false?
Sherry, I'm gonna say false on that one. Are you with me on false?
Yes.
Okay. What is false?
All right, let's see. And I feel like I need a drum roll on the side here, but that is absolutely correct. Huntington's disease is an autosomal dominant inherited disorder. And because of it, the disease does not skip generations. Now, there are a few more questions which kind of talk about this. So I'm not going to give out all the answers right now, but Mary and Sherry, you guys got this. Wonderful. So 300 points to Team B. And then I'll pass it back to Dr. Castaneda for Team C and Brittany.
All right. Brittany, do you have a question?
Let's do diagnosis for 200.
Diagnosis for 200. All right. HD only affects adults. Is that true or false?
False.
All right, let's see the answer. That's correct. So Huntington's disease is not only a condition that affects adult individuals, but also can affect kids. As a matter of fact, less than 10% of patients with Huntington's are children. We understand now that the ways that their symptoms manifest is a little bit different. Sometimes we make generalizations, such as adults usually tend to have more of these excessive movement type of symptoms with the chorea and the involuntary movements. Kids usually present more with lack of movement, with decreased dexterity. So very similar to what it would look somebody that has Parkinson's. Furthermore, the progression of the disease seems to be a little bit faster in the younger generation. So Huntington's affects people in old ages. All right, so that is about that question. Let's pass it to Dr. Chandra for the next one.
All right. So Philip, Cindy, and Jennifer, coming back to you with Team A. What would you like to pick?
Jennifer, do you have a choice?
I'm pretty open, whatever you guys would like to choose.
All right, we're gonna get brave here. We're gonna go to diagnostics for 500.
Oh, geez.
I need that drum roll now. We need to build it up a little. All right. A typical motor symptom of Huntington's disease is A, tremor, which is a rhythmic movement in one or more parts of the body, or B, chorea, which is an involuntary movement, random, jerky movement derived from the word to dance.
I'm gonna say B. What do you say, Jennifer?
Of course.
All right.
Right.
Answer B.
Let's see. Brave choice. Let's see. And you guys are absolutely right. It reads A, but it's Korea. You guys got it spot on. Good job. That's 500. That was a great call that paid off. And then tremor, while it's not out of the realm of the motor spectrum in in Huntington's disease, it's more commonly seen in juvenile Huntington's disease, where you can have tremor, akinesia, and some of the more Parkinsonian features. The choreophone movements have actually been detailed in texts from the 1850s in association with patients with Huntington's disease. So brave choice and well played there. So I'm going to give it back to Dr. Ramirez Castaneda and over to Team B with Mary and Sherry.
All right, back to me. Team B, do you guys have a question?
Sherry, how are you feeling about genetics for 500?
Fine.
Let's do it.
All right, that's ballsy. All right, so the question is the chance of inheriting HD from a parent. Is it A, 25%, B, 50%, or C, 75%? What do you say?
Sherry, I'm feeling very confident about B. Any?
Yes.
Yes, B, 50%.
All right, let's see. Yes, so 50%. The way of inheritance of Huntington's is what we call an autosomal dominant inheritance, which means that if one of the parents has the abnormal gene, each individual, each child has a 50% chance of getting the abnormal gene. If we, it makes sense if we understand that for every disease, for every type of quality or disease known, there are two copies, one that comes from mom and the other one that comes from dad. In the case of Huntington's, the copy that comes, whether it's from mom or dad, has this quality that it will pass down to, it will give you the disease if you inherit it. So since you have two options, there's 50% chance from each parent to get it. That's why from each single individual that is born from that parent with Huntington's, there is a 50% chance. Now, chances are chances, and there are situations where a couple, one parent with Huntington's, seems to have all their children with Huntington's, and it's just due to chances itself. Each single child had the 50% chance and got it. And then there are other situations where one parent has Huntington's and none of the children had the disease. And again, it's because of that chance, but well played. That's the answer, 50%. Pass it to Dr. Chandra now.
All right. I like how the big numbers are coming out now. Well done, you guys. Moving on to Team C. Jamie, you can now join Brittany because we've got very solid teams out here. I don't think I'm going to give you guys an unfair advantage if you put you together. So Brittany and Jamie, what would you like to go with?
Jamie, is there anything you want? I can do another research one.
On treatment for 500.
Let's do it. Treatment for 500. All right. So deutetrabenazine, which is also available under the brand name Austedo, is approved by the FDA to treat which symptom in Huntington's disease? Is it A, irritability, or B, involuntary movements or chorea?
Gonna go with B.
All right, let's see. Excellent job. All right. So I think we've got a big hitters in the club all coming out right now. So another 500 points to Team C. And absolutely, there are 2 FDA-approved medications for chorea associated with Huntington's disease. One is tetrabenazine, and the other is deutetrabenazine. All right. Well played, Brittany and Jamie. I'm going to give it back to Dr. Ramirez-Castaneda and Team A.
All right. Philip's team, what is your question now?
Jennifer, I'm thinking history for 500. What's your call?
I like that. Let's go big.
Okay.
All right, let's
Go
get
big or go home, right?
Yes. All right, history 500. All right, the question is, United States collaboration with which country resulted in the discovering the exact location of the HD gene? Options are A, Spain, B, Mexico, C, Venezuela.
I am going to say C. What do you think, Jennifer?
That's a good answer.
Okay, C.
All right, let's see. And that is correct, of course. In South America, Venezuela, thanks to the collaboration with US and this collaborative research project allowed to the discovery of the gene, it was this physician, Americo Negrete, that in the 1950s studied this specific location in Venezuela called Maracaibo. There's a lot of places in South America that were colonized by Europeans coming to the new continent, and in that specific place, there was colonization of people from Europe, especially North Europe and mainly Germany. And in that specific area of Venezuela called Maracaibo, we had this founder effect where most people have European descent, and somebody brought the HD gene there, and it became very interesting for the local researchers and understanding what is it that is happening here, how is this being inherited, and what is the gene and the cause. And then again, with collaboration with the United States, it led to the discovery of the Huntington's disease gene. All right, some nice piece of history there. And we can, by this type of collaborations across not only institutions and countries, we're able to do wonderful things. So great job, Philip and team. Now let me pass it to Dr. Chandra for the next question.
All right, Team B, Mary and Sherry, what would you like to go for?
Do we want to finish genetics for 400, Sherry?
Sure.
All right, genetics for 400.
All right, so the number of CAG repeats will tell you which symptoms you will experience. True or false?
I think it's false.
I think I agree. I'm going to go with false. I think it tells you the severity of your symptoms, but I don't know that it tells you which symptoms. So B, false.
All right, absolutely correct. False it is. So there's a lot of variability about the number of CAG repeats and what it can tell us, but definitely it doesn't tell us what kind of symptoms would a patient experience. Now, as you know, Huntington's disease has a triad of symptoms. You have motor, neuropsychiatric, as well as cognitive. So the number of CAG repeats, while at times can maybe roughly estimate at what age these symptoms might appear, nothing so far available can tell you which symptoms come first. So absolutely right, and great job, Mary and Sherry. All right, I'm going to pass it back to Dr. Ramirez-Castaneda for Team C.
I'll take the last research for 500.
Sorry, I'm muted again. 500 points playing there. So the question is, HD research can also contribute to the knowledge of other movement and cognitive disorders. An example, Parkinson's disease. Is this statement true or false?
True.
All right, that is correct. again, talking about collaboration and sharing information, any type of advanced discovery that we make in any of these neurodegenerative diseases, it just means to us that we're one step closer to understanding everything as a whole. And then a lot of the times we can extrapolate from those type of findings and apply to that specific condition. In one of the areas that is extremely clear is, for example, in the research of Parkinson's and Alzheimer's, where there's a lot of things that we share in common, but again, with advances in trying to get to the bottom of the cause of these conditions, such as genetic proteins and all those networks, there is definitely a great deal of collaboration and common knowledge that really gives us one step closer to really understanding, hopefully getting to disease modifying or curative type of treatments. So very well played. I'll pass it now to Dr. Chandra.
All right. I think everybody can see where the scores are. Team A is at, and Team C are at 1,300, and Team B is at 1,400. Lots of questions left on the board. It's still pretty close. So let's go ahead and we'll get started. Go back to Philip's team with what would you like? Team A.
Jennifer, any special?
I think we should do what's on the horizon for 400.
Okay, good call.
All right, let's see what's on the horizon. Okay, so in gene therapy using AMT-130, also known as the Unicure trial, the substance is directly delivered to, is it A, spine, B, brain, or C, skin?
I'm going to say A, Jennifer.
I thought it was brain.
I would say B, brain.
Yeah,
Okay.
brain. I'm saying brain.
Okay, we'll say B.
All right, so Cindy, Jennifer, and Philip, let's see what the correct answer is. This moment of truth, and absolutely correct. It is the brain. So the AMT-130 trial actually has a vector, which is a deactivated adenovirus, which carries artificial microRNA, which is a piece of protein that helps kind of recode the Huntington protein, and kind of it's tailored specifically to lower the Huntington protein level. Now, it is non-selective, so which means both the mutant and the wild type or the normal Huntington protein level is lowered, but it is actually injected directly into the striatum of the brain. So great job, and you guys get 400 points. All right, over to Dr. Castaneda and Team B.
All right, that was very well played. At the last minute, I thought, oops, that we're going to have our first wrong answer, but nope, you did great. All right, so what do we choose now?
Sherry, how are you feeling about diagnosis for 400?
All right,
Okay.
getting the big numbers. Wonderful. All right, diagnosis for 400. All right, the question is, all patients with HD will experience depression. Is that true or false?
I want to say false.
I'm going to say false too. All seems like a too confident of a word. So we're going to say Alex B, false.
That is a very good deduction. All right, yes. So the answer, it's false. Not all individuals will experience depression, and that is true for all the motor and non-motor symptoms. As you mentioned, all seems a very strong word, and now the more and more we know about conditions and get to the bottom of things, we know that that is not the case. So if they do, however, there are effective measures, medications, assistance that we can have to help individuals who are having depression. It is very well known that depression is a very common non-motor symptom of Huntington's disease. And in Side depression, the risk of suicidality, suicide is something that we always are aware of and discuss with our patients, because it's always good to have a plan to identify signs early on and to hopefully have a nice network that starts with the person themselves understanding what these feelings are, how to address them, and how to find help, then within the family, with their physician, and kind of a broader spectrum beyond that. So amongst many places that we can have help, there is this National Suicide Prevention Lifeline, which is something that we always share with our patients and make them aware. And again, it's something that we're always monitoring. But back to the question, every person with Huntington's experiences in a different way. And when there are some patients that may have A and B symptoms, the others may not. And that is true even within the same family. So that was very well played. All right, back to Dr. Chandra for the next one.
Right. Oh, it's still so close. All right. Brittany and Jamie, what would you like?
Jamie, you want to go again this time?
You pick.
Okay. Let's go with history for 400.
All right. Let's see history for 400. All right. So the oldest HD support organization is A, the International Huntington Association, or B, the Huntington's Disease Society of America.
What is HDSA?
All right. And drum roll. So perfect. It is what is HDSA. It was founded in 1967. I won't say by who as of yet. And then when it was founded, it was actually called Committee to Combat Huntington's Disease. So that was its initial form or avatar, which over the years has now become the Huntington's Disease Society of America. All right. Great job. Everyone's still kind of neck to neck with Team B, Mary and Sherry taking a slight lead. So over to Dr. Ramirez Castaneda and for Team A.
All right. Okay, Team A, what is it going to be? Big numbers, low numbers?
Okay, I'm gonna say we go for treatment for 400. Are you okay with that, Jennifer?
I'm with you. I think that's a good idea.
Okay, let's play for 400 points. Exercise and lifestyle change can improve motor function and balance in Huntington's. Is that true or false?
True.
We're gonna say true.
All right, let's discover the answer, and it's correct. True. Physical therapy and exercise, especially aerobic exercise and resistant training, have demonstrated to provide great level of control and improvement of motor symptoms, allowing patients to have better mobility and also balance and gait. So we're always encouraging our patients towards a more active lifestyle, and if that's guided by exercises, that's great. Very well played. 400 points to your team. Now let's give it back to Dr. Chandra for the next one.
Right. Mary and Sherry, what would you like?
How about history for 300? Sherry, how are you feeling about that?
Okay.
All right.
All right, let's pick. Yep, so this is the reason I didn't include who founded HDSA earlier, and I apologize, I didn't mean to be cryptic. So your two choices are Marjorie Guthrie and B is Bob Dylan.
I'm feeling good about this one. A, Marjorie Guthrie.
Yes.
All right, let's see. And you guys are absolutely correct. In fact, if for those of you who attended our first session, Marjorie and Woody Guthrie's granddaughter, Anna Canoni, played a wonderful tribute to her grandparents and led us in a musical journey, which was fantastic. And Bob Dylan was actually a close friend of the musician Woody Guthrie, Marjorie's husband, and he actually wrote a song for Woody based on Woody Guthrie. The poster over there is because of Marjorie Guthrie's work, the National Library of Medicine actually named their entire series on Huntington's disease in her honor. So it's called the Marjorie Guthrie Lecture in Genetics. All right, very well played, Mary and Sherry. Over to Dr. Ramirez Castaneda and Team C.
All right, Team C, what is it going to be?
Let's do diagnosis for 300.
That's great. 300 diagnosis. So family members with Huntington's will have the same symptoms. Is that true or false?
False.
All right. That's right, false. Everyone experiences Huntington's differently. And I already alluded to that in one of the previous questions. That's not only true for Huntington's, but pretty much for any type of condition, especially in our world of neurology. Every individual experiences differently. And even within the same family, there are some cases even within paternal twins that the disease may manifest in different ways and at different times, because we're humans and we are subjected to multiple internal kind of genetic factors and external environmental factors, and exposure to those is what makes us such complex living organisms in this world. So that's correct. More points for our team. Now I'm going to pass it down to Dr. Chandra again.
All right, so gosh, Team A and B are exactly neck to neck. So Team A, Philip, Cindy, Jennifer, what do you guys want to go for?
Jennifer, the choice?
Okay, I'm gonna say what's on the horizon for 300.
All right, let's see what's on the horizon for 300, please, Shan. Wonderful. So Huntington's disease is caused by a single gene mutation and therefore a good candidate for therapeutic gene product modification. Is that true or false?
I'm going to say true.
I think
Jennifer?
true. I think true.
All right, let's see. Imaginary drum roll in everyone's head. And absolutely, yes. We're playing the big numbers now, so absolutely right. And you know, because Huntington's disease is caused by a single gene mutation, there is a lot of scope for targeted therapies based on this. However, the recent ASO studies, which is based on antisense oligonucleotides, didn't quite pan out. And I think one of the studies, the Roche studies, was stopped prematurely, and the WAVE study had a negative outcome, which means that they were looking at seeing if the mutant Huntington protein levels were lowered, and that was not the outcome that they saw. However, this is still a promising approach to gene silencing, and with the hope being that these small stranded pieces of DNA will kind of attach on to the gene and decrease the production of the mutant Huntington protein. So there is still a lot of research and a lot of promising trials in process attempting to reduce this mutant Huntington protein level and prevent the cumulative effects of the disease. All right, very, very well played. Over to Dr. Ramirez Castaneda for the next team.
Okay, very well. Whose team is up right now?
Team B is next.
Team B. All right.
Actually, C, my bad, sorry. Team B just finished, Team C is next.
All right.
That wasn't us. That wasn't Team B that just did that one.
Oh, sorry. You guys are actually neck to neck, so which is why I apologize.
All right.
Mary's
Mary?
team is next. Yeah, my bad. Mary's team is next.
All right. Team B. What is your option, your question?
I'm going to say treatment for 300, Sherry, and I'm really glad I didn't get that last one because I would have not.
Okay.
Right. Yeah.
All right. Let's see. Cheyenne, please.
Sorry, I have a question. Was the last team Team B that answered, or Team A?
It was Team A, so I think that's what the scores threw me off.
Yeah.
Yeah.
this is right. Okay.
Yeah,
All right.
perfect. Okay, thank you.
All right. So this one was treatment for 300, Shan.
But I think our score was right. I don't know. Oh, there we go. I think that's right. Okay, yes.
All right. The question here is abnormal movement, chorea in Huntington's can get worse with stress and anxiety. Is that true or false?
Sherry, I think that's true. What do you think?
Yes, I think it's true.
Okay,
All
I'm
right,
gonna go with A, true.
All right, let's see the answer. And it's true. Chorea, it's very dependent on the level of stress and anxiety. And as patients and people with Huntington's and their relatives and us physicians can see, we can have very levels of severity on the chorea going from very subtle to where you don't even notice it to pretty severe, and that could happen in the same individual within the same day, and the only factor that is different is their level of stress of anxiety. So not also only particular to chorea, but again for most of these neurological symptoms or manifestations where the stress and anxiety played a great role. So as far as thinking ways of improving the control of these motor symptoms, especially the chorea, things that we can also do is try to manage a little bit more stress and anxiety. And I always tell my patients, you know, life is life, and it's not as easy as saying I prescribe no stress. But on the other hand, we can find instances and periods of time where we can do things that cause relaxation. So it's more realistic to say, let's improve conditions, situations, activities that produce relaxation than saying don't get into stress, because life is life. So that's something that always helps. All right, so that was very well played. Another correct answer. We're getting close to the end. Now I'm going to pass it down to Dr. Chandra for the next question.
All right, and before I jump into the next question, speaking of stress, right after this, we're going to have the wonderful Brenda Tapia. Hi, Brenda. Nice to see you. Lead us into a wellness session. So hold on to that thought, and we're going to try to hit those remaining questions on the board. Okay, you guys are neck to neck, Team A and B. Team C, Brittany and Jamie, what would you like to pick?
Jamie, is there anyone you want? We'll go with the genetics for 100.
All right, let's see. Only men can inherit Huntington's disease. Is that true or is that false?
It's false. Sorry, I had groceries at the door.
Okay. All right, so it's false. And I think everybody here today knows that, so I'm not going to delve deep into it, but both men and women can be born with the mutant Huntington's disease gene. All right, back to Team A, Philip, Cindy, and Jennifer.
All right, Team A.
We'll close out the history.
All right, let's close down history for 200. Which of the following day is designated as the International Huntington's Disease Awareness Day? August the 15th or May the 15th?
I'm going to say May 15th. What do you say, Jennifer?
I think that sounds like a good guess.
Okay.
All right, and that is correct. May 15th marks the International Huntington's Disease Awareness Day, and it is an amazing opportunity to make people aware of the multiple facets of Huntington's. There might be misconceptions outside our circle that maybe Huntington's is only a motor disorder where it only comes with abnormal movements. But part of the effort of this awareness is to understand that Huntington's is not just the abnormal movements. There are also neuropsychiatric symptoms with mood disorders and cognitive symptoms with memory issues that are part of this part of the condition, and emphasizing in the importance of addressing all those three spheres. So May 15th is the International Day of Huntington's Awareness. All right, we only have 3 more questions. So Dr. Chandra, to the next team.
Mary and Sherry, what would you like to pick?
Sherry, do you want to do what's on the horizon for 200? That's a weak category for me.
Sure.
All right, we're going for it.
All right, so mRNA-based COVID vaccines are safe for patients with Huntington's disease. Is that true or is that false?
I'm going to say that's true. Sherry, do you agree?
Yeah, I'm not sure what the mNRA is, but
That's
can-
the Pfizer and the
Mhm.
and the
Moderna.
Moderna.
Yeah.
so true. Yeah.
All right, fantastic. And I know a lot of people have had apprehensions about vaccines, which potentially can alter mRNA, but it's just a learning lesson that there's a lot of mRNA in our genes. And so COVID vaccinations are not contraindicated in patients with HD. And while patients with Huntington's disease are not more predisposed to getting the COVID-19 infection, if they were to get the infection, then the complications from the COVID-19 infection would be far worse than any potential risks with vaccinations. So please get vaccinated if you have not already. All right, so over to Dr. Ramirez-Castaneda and Team C.
All right, Team C, what is it? Diagnosis or treatment for 100?
Amy, do you have
Diagnosis.
All right, diagnosis for 100 points. All right, the question is, the diagnostic test of choice to determine if one has the Huntington's disease mutation is A, through brain biopsy, or B, through direct genetic testing for Huntington's?
B.
Yep, B, direct.
B, direct genetic testing? All right. Yes, that is correct. So genetic testing for Huntington's disease is the final diagnosis, and because we are basically getting to the point mutation that is present in Huntington's disease. Sometimes in some neurological disorders, we don't know the cause yet, and diagnosing becomes very complex, and we have to go through a lot of clinical history, some testing following over time. But with Huntington's disease, we can get some blood and then test it for the genetic presence of the abnormal mutations. So when we get the results for Huntington's, we have to understand that we all have these repeats that are part of this protein called Huntington, but the number of repeats is what is important and marks the difference between having the disease or not having it. So a normal presence of these nucleotides, which are these little components that help create bigger things like the DNA, are the CAG, and those we call those CAG repeats. And we normally, as part of our Huntington, we have up to 26 of those repeats. There's also a level of those repeats that can go up to 35 repeats. We call that the intermediate. But definitely, if at this number, we don't have the diagnosis of Huntington's disease. However, when we get higher numbers, we make the diagnosis of Huntington. So basically, it's very straightforward when we get the genetic testing and we have the confirmation that there are 40 repeats or above. That is it's a full penetrance and it gives the diagnosis of Huntington's. Patients who have repeats from 36 to 39, they have reduced penetrance, but again, they are in that range that is a higher number with Huntington's may develop at some point in the line. So the interpretation of the number of repeats, it's also very important and really kind of tells us and gives us an idea of where we are in that spectrum. So genetic testing is the confirmatory diagnosis for Huntington's. Great job. Now we're down to the last question, and I'll give it back to Dr. Chandra.
All right, so it would be unfair for me to give the last question to just Team A if there wasn't anything Team B could follow it up with, right? Because we're at a tie. We're at 2,600 points each for Team A and B. And Brittany and Jamie, well played, but you guys are at 2,200. So I think it's going to be between Philip's and Mary's team. So I'm going to have this question open to both teams. All right, so get ready, unmute, be ready. Okay, so before we click on it, are both teams ready? Mic check. All right, I can hear Philip.
Ready?
All right, let's go ahead and see. Treatment for 100 open to teams A and B. Teams.
B, false.
Okay, I feel like that was so close. I heard Mary and then I heard Philip. Okay, so let's see what the answer is. It is false. Absolutely. So there are currently no the question was, there are no medications available to treat the symptoms of HD, and that's absolutely false. There are medications for symptomatic management of Huntington's disease, which are effective as well as safe, as well as non-pharmacologic strategies. So it was really close. I feel like we're going to give that point to Mary's team because we did hear her first, but I'm going to offer a bonus question right now for 200 points to both team A and B. Who can hum the Jeopardy theme song? I think, what do you think? I think Team A did a great job there.
I think it's Team A. They
All right.
All right.
So Team A gets 200 points there. Wonderfully played. It's so close, you guys. We're such amazing sports and such experts too. So thank you for playing and learning and enjoying this with us. I'm going to go ahead and have Cheyenne put up the slides to lead us into the next segment. Before we move on, can we get a big round of applause for all teams, virtual, actual? Great job.
Great job, everybody. I'm amazed the knowledge that this group has about Huntington's. So well played.
And well hummed. And yes, really good job there. All right, Shan, could we get the slides up, please? All right, so leading us in today's wellness activity is going to be Brenda Tapia. Next slide, please, Shan. So Brenda, thank you so much for joining us today and lending us your time and expertise. It's an absolute honor to have you. Brenda is, what's the term? A true Renaissance woman. She has so many dimensions to her personality. She's a certified health coach and yoga instructor. She's a lawyer and has a background in contract negotiations. And she's a nutritionist, a foodie, a yogi, and she handles all of this almost seemingly effortlessly. So I'm sure there's a lot of thought and effort that goes into each and every single aspect of her life. But her focus is transforming complex information into simple, understandable solutions for those who she works with. So Brenda, welcome again, and I'll let you get started. Brenda will be here with us for not just the session today, but the following few sessions as well.
Here. Thank you so much for the introduction, and I feel grateful of having the opportunity to learn about something new. I was not aware of this condition, and the invitation is helping me also to have more knowledge about this. And well, the intention of this session is it's providing orientation of what we're going to do in the following sessions. I think there is a concept that we have all learned about it or hear about it, but it has come to our life in when we're adult, probably. Like we start learning about it when we get older. As I have seen it with in my experience and with other people, and it is anxiety. Anxiety is feeling that we all have gone through that, and however, it's something that no one, for most of the people, no one explains us about that feeling in our body. Where does it feel? How does it feel? And in my experience, what happened is that I was having the feeling of a big hole in my chest. And I remember someone asking me to explain about the feeling of anxiety. And my best way to explain it was when you are in a roller coaster and you're on the top of it, and you know that you're gonna just move, the cars they're gonna move down, and you have this feeling of space in the chest. And for some people, the hole in the chest could be, the size could be different, and it could be different each day. And getting to know how this happened and how to manage it is a great opportunity to improve our lifestyle. There are plenty of options outside to approach anxiety, but also there are plenty of options to dump anxiety, right? Like whenever we have these sensations of anxiety, which each person might feel it in a different way. As I said, in my experience, it's kind of a hold in the center of my chest, and a way of numbing the feeling. It was watching TV, for example, or using certain food, like type of processed food that I will have a lot of sugar, and that will bring me kind of a relief, temporary relief. Or it could be wine or beer, or so those are other options which that might numb my anxiety. And the best way to move forward, in my experiences, was to stop avoiding labeling those behaviors as good or bad. Instead of labeling them, I just started to be aware of the behavior and describe it in the whole experience. And what I meant with that is when we use resources as numbing the feeling of anxiety, it's a temporary behavior, it's a temporary relief, and which will cause effects that after having this relief, the effects after that might feel different in our body and in our emotions. So that's a description of the experience without calling it as a good or bad behavior. So we have that, and we have other resources to approach anxiety, and that could be mindfulness. And mindfulness can be approached by different techniques. It could be by body screen, which is following a meditation, and you while someone is guiding you on the recording, you will follow every piece of your body. And that when we repeat that behavior of when we bring constantly this practice in our day-to-day activities, you start to build like the gap between yourself and the body start to reduce. But the difference with this, and again, it's not a bad or good, it's just recognizing both experiences. And in in the experience, for example, of body screening, this is something that it's something that needs to be developed. And it takes time, it takes effort, it takes consciously deciding to put it in our schedule as a priority and consciously deciding every day to move into that priority. And in the other aspects of or other resources that we have for numbing our feelings of anxiety, it's a short effect that has effects, and it's a matter of choosing how do we want to manage that second effects, like if we want to accept those second effects. So we have both situations there. So going back to the resources of mindfulness, I was saying it could be body screening, but also it's just by sitting in a comfortable position and just focusing in a specific sensation of our body that we will make it our anchor. So whenever we go through an uncomfortable situation, we can go back to this environment that bring us peace. But in order to bring that to our real life, like whenever we are exposed to those situations that we know that they will trigger our anxiety, in order to start getting our mind familiarized with this behavior of moving into this comfortable zone that we have created, that it's our anchor, it also needs to be something that we practice continuously. An anchor could be feeling the air in your nostrils. Just close your eyes or lower your gaze and you focus on the air that it's running through your nose. Another anchor could be the sensations of your fingertips on the desk. Another sensation is a feeling of your feet on the floor. And while you stay there, while you choose your anchor, you start to developing this area of where you can move from uncomfortable to uncomfortable, no matter that the uncomfortable situation is still there. Because whenever we are, and I'm gonna make a parenthesis here, whenever we are in an uncomfortable situation, we have 3 different options, or it could be more if someone can bring another reaction to that. But whenever we feel uncomfortable, one of the reactions could be move out from that situation. We can just turn around and just not being on the uncomfortable anymore. So we will turn around and move out. The other reaction could be numbing the situation. So I was listening to one doctor recently. He's Canadian, and I forgot his name, but anyway, he was saying that how much we prescribe ourselves to numb certain emotions. Like right now, I'm focusing on anxiety, but whenever for example, in my experience, I notice myself that whenever I feel in an uncomfortable situation of gathering with other people, new people, in a event with coworkers, which actually had an experience recently, the kind of knowing that uncomfortable situation, it could be grabbing a glass of wine. So that will numb my feeling of uncomfortable, and I will be able to just interact, which was my uncomfortable. So that's, again, it's not good, it's not bad. That's another way of reacting. And the other way of reacting is staying on the uncomfortable situation and start making this link with our own anchor, which we could be any anchor connected to your body that will bring you this sense of feeling comfortable, even though the uncomfortable situation is still there, and you are in the same space as the uncomfortable situation. So that's what we are going to be focusing on the next sessions. It's going to be a kind of one of my mindfulness teachers call it buffet. So whenever you go a buffet, and I have a 6 years old, so it's, as a parent, you're kind of inviting them to try the food, like just try it, and if you don't like it, just don't eat it, but try. That's my intention with these sessions, to share you different approaches of how to experience uncomfortable situations. And from there, you can choose how it feels better for you, what it makes sense to you. And in each of the sessions, we will be open for questions and sharing the experience. And I might probably, if it's possible, send links for meditations that you can follow during the week, and then we can share, each of us, our experience of bringing this new technique during 1 week. So it's that's basically my first introduction session. I don't know if someone has a question.
Thank you so much, Brenda. I was just thinking of what you mentioned about our response to certain situations. So yesterday I was reading about the COVID surge hitting Houston, and my way to transition from uncomfortable to comfortable about that is eating. So I do tend to stress eat. So I went and ate. We went with my husband, and when I came home, I felt better for maybe 30 minutes or 40 minutes, but that doesn't change the fact that the situation still hasn't gone away. So I love the concept of finding an anchor which can help sustain my response to a stressor, whether actual or anticipatory. So I really, thank you for kind of introducing those concepts, and I look forward to sampling the buffet, the wellness buffet, not just the food buffet.
Yes, I'm happy to help here to share more of what I have learned from other teachers, and because their teachings, they have been very helpful in my life. It's so nice seeing others sharing their own experience and their own learnings. Because of that, we continue learning and sharing the knowledge, and that's great.
Wonderful. And I know so many of my champions of our HD community are on this call today, and many more will join us for the next few sessions. So if any of you on the call have any particular kinds of mindfulness or yoga or anything, please let Brenda and myself know. We're happy to kind of cater a session to that. I'm using a lot of food references. I apologize. But I think the breadth of her expertise is fantastic. And so if there's any particular technique or anything else you want to know about, please let us know. And Brenda, thank you. That was like a wonderful overview. Questions or comments, anyone? All right, so we will let everybody go ahead and enjoy the rest of your weekend. Thank you so much again for joining us today. Shan, can you go to the next slide? Our next session is going to be on August 28th. Please register on the site, and we look forward to having you all there and learning and sharing together. Thank you so much. Have a wonderful rest of your day.
Thank
Thank
you.
you.
Thank you very much, everybody. Have a great day.
You too.
I don't know. I can't. Okay.